Have you been told that your digestive problems are just part of getting older? If so, you are not alone. Many seniors struggle with persistent diarrhea or constipation or bloating or abdominal pain, and far too often they are dismissed with the idea that this is normal at your age. The truth is, age is not the cause of your digestive problems. What matters is finding the right doctor who understands how to identify the underlying issues and provide the right treatment. Hi, I'm Dr. Stephen Wangen, the founder and medical director of the IBS Treatment Center, and I want to tell you about a patient that I just saw recently. One of my patients here, and just saw her this week. In fact, an 87-year-old woman came to me after months of suffering from persistent urgent diarrhea, and she was exhausted and frustrated and worried about leaving her home for fear of having an accident. And like many older adults, she had been told by other doctors that her symptoms were just part of aging and that there was nothing else that could be done with it, and just take Imodium. Well, that's not a cure. And she knew that something wasn't right, and she refused to settle for that answer. And after a careful evaluation and a really highly personalized treatment plan, we were able to identify the cause of her diarrhea and resolve it. And today, she is back to her normal life. No more urgent trips to the bathroom, no more fear of leaving the house. And this is a powerful reminder that digestive symptoms in seniors are not caused by age. They always have a reason, and with the right help, they can be treated. Now, what are some common digestive problems in seniors? Digestive issues in seniors are not inevitable, even though they're common. And some of the most frequent problems include chronic diarrhea, could be sudden or urgent episodes that disrupt your daily life. It could be constipation, which of course is difficulty passing stool. Could be IBS, irritable bowel syndrome, which can include abdominal pain, bloating, or irregular bowel habits. And it could be things like food intolerances or gut infections. If you are experiencing any of these, don't let anyone tell you it's normal for your age. These conditions have solutions. Unfortunately, older patients are sometimes overlooked when it comes to digestive care, and doctors may blame your medications or reduced activity or just aging. And while these factors can contribute, they are rarely the whole story. The real issue is that the root cause is not being addressed. So whether it's a food sensitivity or an imbalance in your gut bacteria or another hidden trigger, your symptoms deserve thorough investigation. So don't let age hold you back, because digestive health matters at every stage of life. Whether you're 67 or 77 or 87, you deserve to feel comfortable and confident and in control of your body. And if you or a loved one is struggling with things like persistent diarrhea or unexplained constipation or abdominal pain or bloating or IBS-like symptoms, know the answers are available. So the bottom line is, my 87-year-old patient is living proof. It's not about age, it's about having the right doctor and the right approach. And she's not the only one. We see a lot of patients who are in their 70s and beyond, and they get consistently better. So don't let anyone use age as an excuse for your digestive problems. If you're struggling, seek out a specialist who will listen and dig deeper and help you find real solutions, because your digestive health can be restored at any age. And at the IBS Treatment Center, we work with people literally all over the world via telemedicine, and we'd love to help you too. And that distance is not an obstacle to us being able to help you or to you getting better. So please give us a call. Thank you for watching. If you found this video helpful, please give it a thumbs up and subscribe to my channel for more information about your health. And remember to take good care of your body. It's the only place that you have to live. Thank you for watching. We create informative videos like this weekly. So if you enjoyed it, please help our channel by sharing a screenshot or the link to the video on Facebook or Instagram or your favorite social media. And be sure to tag me wherever you post and let me know what you liked about the video and what topics you'd like me to discuss in the future. If you visit our website at ibstreatmentcenter.com, we're currently offering a free ebook on how to beat IBS, so be sure to check that out. It's time to take control of your digestive problems and get your life back. I'd also appreciate it if you could subscribe to our channel here, like this video, and leave a comment or question below. I'll do my best to read and respond to all of them. Thank you, and until next time. Everything, hopefully the sound is good. Here we go.